right? And in many of the cases, it was so easy to take one run. Now that mattered in the final result.
My dad also mentioned that.
By the way, boss, you guys ask amazing questions. Huh? And yeah, for those who are who are joining today for the first time, right? I'll be answering. I put even your questions also. Don't have to worry. Let's start slowly. This is the YouTube link. So if you do www.youtube.com/@Dr. Bankim Jani, and you'll reach to the YouTube channel. There you go to the playlist, and in playlist, everything is there. Right? From general anatomy, upper limb, lower limb, this, that, everything.
Sir?
Yes, bolo.
Sir, I had sent my blood test reports to you on the mail.
I saw that, and because in the benefit of everyone, I haven't replied to your mail, right?
Yeah.
No worries. I put that thing into our questions, D3, B12. So we'll be talking about it. And they are low.
Yes.
So you don't eat properly? By the way, out of all of you, right now we have got one side. Who is foodie? Who loves eating?
Yes, sir, me.
Okay.
Loves but had to do fat loss.
That's okay. अरे यार, fat loss हो जाएगा. I am such.
I am a foodie.
तो कोई invite ही नहीं करता खाना खाने के लिए. No one invites me. मतलब हॉस्टल में थे तो बोर्ड मारा था, literally नाम लिख के. Because on that Sunday I ate 128 gulab jamun. You said about reminding about the anatomical. अच्छा. अच्छा याद किया. I mention it over here as a 11th number. Coronary circulation. Though you will be getting answer of this thing in detail when we'll be discussing coronary angiography or the anatomy of the heart, but still we'll cover it. Yes, Athar, बोले ना.
It's a mistake, sir.
ऐसा नहीं करने का, कुछ भी बोल देने का. मिस्टेक क्या है इसमें? कुछ भी बोल देने का. So 2 minutes past 10. We start. Chalo, let's start. Gradually we start. So within next 10-15 minutes, we'll be coming to the main topic. भाई मेरे, अगर जो तू मेल भेज सकता है तो तू ज्वाइन क्यों नहीं हो सकता? We wait for 2 minutes. Right? 2 minutes के बाद start. So meantime, let's take the questions. Yes, this email address, right? Till you are Mbbs. So that is the email on which you can send the message even right now also. This is for those who are joining for the first time. And in case if you don't have that link where we are storing, because I'm getting few emails that where will we be getting the PDF. So just send a mail or I'll reply to your email sending you the link. So that's where everything is there. So no worries. So he is Henry Gray. जिसने इतनी मोटी बुक लिखी, but no, his work is really good. All right, let's start with a few of the common questions. And one of the question was that USMLE, PLAB, right? They require time. Yes, they require time. 10 years, 12 years, even more than that, till you become specialist and you start earning wonderful. But yes, it takes time, right? The moment you say that you want to become a doctor, those 10 साल तो दे दो. Because by the time you'll complete your MBBS, say 5.5 years, then you will be doing 1 year of internship, then you will be doing post-graduation. So Maruna total, right? 9.5 to 10 years, so it is in this much only. Now, if from this point you feel like you want to go for USMLE, so you count another 5 years till you become specialist. So total 10 to 12 years, right? 10 to 12 years. This is the time duration what you have to really remain dedicated. But after that, yes, life would be totally different. So, yes, that's
So what if we go for a PLAB instead of USMLE?
Okay, now the thing is that in PLAB you have to spend more time, right? You'll be ending up in say
Foundation year and then
spending less, right? The fees would be less, but in order to become specialist, you have to spend about another 5 to 6 years, right? So it adds another 2 to 3 years extra. So say for example, right now, if your age is roughly, I'm writing, right, for the ease, or let me write 18, right? If your age is 18, so till you will become 30, 31, you are studying only, right? It's a long journey.
Yes. Okay.
But yes, as you become resident, you'll start getting the stipend, etc. But that is very less. That is very ठीक. मतलब $60,000 if you are getting, तो $60,000 ऐसा नहीं कि oh you convert के अच्छा 86 rupees का rate, so अपने को तो 50 लाख मिल रहा है. हेयर कट के लिए जाओगे मेल्स को बोल रहा हूँ, राइट? तो $20 दे के आओगे. फीमेल्स तो आप तो भूल ही जाओ.
Sir, what's the cost for USMLE then?
USMLE cost, say as such, USMLE will be, you need to keep the target in the form of about 25 lakhs. Now this includes everything. Step 1, step 2, step 3, your travel expenses, your staying in US for 3 months. All. So the major expense, right, that will be coming when you'll be going for that step 3, right?
Sir, after that, fees is also required or not?
Sorry, again?
After clearing USMLE, fees is also required or not?
No,
College.
वो वहां पे, that is what you'll be doing in US, not in India.
Right? So what about ANC?
Sorry, one person.
It's okay, let him go ahead.
Sir, I was asking about US college only.
US college. So that is when, say, once you complete USMLE, that means you are at an MBBS level. Got it?
Okay.
That means now you are equivalent to person who has done MBBS in US. Then starts as if say in India, once you complete your MBBS and your internship, you get admission in post-graduation and you continue. But now USMLE, it tells no, you have done MBBS in India, we don't consider it. You appear for this exam. So it gives you United States Medical Licensing Examination. That means now you are licensed to practice in US. So once that thing starts, so you will be doing the practice in US, and parallelly now you start what is called as the specialization. So that takes another 3 to 4 years. Right?
So can we also talk about Australian entrance exam?
Same, see, more or less all of them, they are similar. So we'll be keeping one extra day for all these things. Right? Because individually, if we'll try to go, we'll end up in spending the entire time for this only. But the whole idea was regarding this. The answer to one or two of the emails, right? Not taking the name, as you said.
Yes. Sir, could you just tell us like the cost and duration for AMC as well?
All those costs and everything is bit approximate, and PLAB is less costly, AMC is less costly, maximum is USMLE.
But AMC is the same duration as PLAB?
Same durations are plus or minus 1 year here or there. So,
okay.
Acha. So, but it is the point is what you asked in the email was that is it justified to wait so much and is it justified to spend so much? Totally, it is like depending on you. It is exactly like that 100-meter race is good or marathon of 42-kilometer is good. Bas. It is like that. If you have got the passion, if you really feel connect, no problems. This is the time of the life because when the energy level is at its peak, yes, I can dedicate my 10 years. But those after 10 years, your life would be different. एक sentence में बोल दूं, आज तक कोई डॉक्टर भूखा नहीं मरा. Trust me. कोई डॉक्टर भूखा नहीं मरा. I think that answers everything. Right? So it would never ever happen that you are out of job. And it will never happen that you are retired. You'll never retire. Right? It is like it would be your wish when you feel like नहीं आज से काम नहीं करना मुझे. It's your wish. So बस that's the thing. हाँ वंश बोलो बोलो.
Sir, I have a doubt. Once we complete our MBBS course, do we have to immediately appear for USMLE or we can take a break of 1-2 years and then appear for it?
Absolutely. After completion of your MBBS, right? After completion क्या? Those USMLE step 1. This is what I tell to my students and I tell them to appear in this order. After you complete your second MBBS, अभी आपका तो पूरा MBBS खत्म भी नहीं हुआ, right? Just you have completed your second year of MBBS. I say go for step 1. But this is possible only when you are very efficient and you have completed pathology and pharmacology. Now, those two subjects, they are monster. Right, they are that long. So if you're confident, I would say go ahead, yeah, karo, and you'll clear it. Step 2, which is CK. CK is clinical knowledge. Now, in that they will be asking you the diagnostic questions. Now that requires bit of experience, bit of work also. So that you comfortably give after your third year. मतलब जब आप MBBS खत्म किया, after that you do it, right? Because by that time you are efficient enough. And you'll be able to do it. But step 1, to just after second MBBS, one can, right? But it totally depends upon, and it is not a very big expense, right? Exam is costly. It is 1 lakh rupees. 1 lakh rupees is the exam cost. Yes, Isha?
Sir, is there any duration, like limitation after, suppose I gave in third year, step 1, and after, like any time scale we should compulsory give within that
You should
time
appear,
bracket?
yes. You should appear for step 2 within 3 years.
Oh, so 3 years is time limit.
Which is enough time. Because if someone has given step 1, that means he or she is thinking about USMLE. So 3 years, so that is more than enough.
Okay, sir.
And once
the 25 lakhs expenses you told
that is the when you have to go
overall, right?
Overall means it is like when you go to US and you are going into some of the electives. Electives means these are the special trainings which are offered by some of the hospital and they charge about $3,000 per month. Right? It is
okay, and like the stipend we get, will be able to reduce some of that amount.
You will start getting the stipend after you complete your USMLE and then you are into some of the hospital associated with that hospital and then they start giving you. Because now USMLE tells that, okay, now you are qualified as a person who can do the practice in USA. So now we must give you something. And that money is in the range of about $60,000 to $70,000. $60,000 to $70,000 is a bare minimum. You can't do the luxuries ke chal yaar Las Vegas jaate hain aur paisa udao, right? No, you can't do like this. No. It is the minimal cost. You can live happily, but you can't save much. Though as an Indian, we usually उसमें $1,000 भी बचाते गए, तो by the end of the year or 2 years, सारा पैसा निकल जाता है.
So 25 lakh will compulsory, like minimum it will come.
That is in case if someone goes, it is not compulsory. In case if you want to go for electives, and that elective is like when you spend $3,000 per month, and that training is for 3 years, so it is about $9,000. So
Sir, what is electives?
So these are the special trainings which will carry the special weightage, extra weightage into your CV when you'll be making your CV. Okay, I think we stop the USMLE part right now, because else we'll be carried away for this.
Sir, just one last question. When is step 3 to be given?
Step 3, step 3 is after you complete your 1, 2, you make your CV, you apply for the colleges, and then those colleges, they accept you, those hospitals, you start working, you go to US, and there you appear for step 3. So when the step 3 you are giving, you are already in US and working, because that's how they say. Step 1, 2, they can be given in India or any other country in the world. Step 3, only US. Only US. But once it is step 3, to matlab you are already into the, if someone is not performing very good and fails in step 3, so then it would add a dent into his CV, his or her CV, कि यार ये fail हुआ या fail हुई. But ठीक है, people give second attempt और हो भी जाते हैं pass, nothing to worry. Because by the time you reach to the step 3 ना, तो you are dedicated, you know that मुझे बस यही करना है, right? So in all these things, it is like, you know that it is a long journey, target is fixed, and then you start running. Right?
Sir, actually I had a doubt about residency.
अभी नहीं दोस्त, अभी नहीं. Residency and everything, that is just too long यार. अभी आज से कम 10 साल के बाद की बात है. So we'll talk about that is on the day we'll talk about USMLE. Right? Otherwise, that's what I said. So we have spent 15 minutes only on this. I wanted to finish. Right? Yeah. So
can you keep a session separately on this topic?
Keep a session separately at a later stage. Right? There are still so many things to be covered. अभी के लिए सिर्फ इतना कि just you need to, why we are talking about USMLE or any other thing, so that you know that these are the options open. Right? These options, they might change as we'll proceed in our journey. Right? So अभी के लिए इतना टेंशन है. Regarding the laptop or iPad, काफी बार इतनी सारी emails आई. Let's make it very clear. Laptop, if you are going for laptop, so then ideally i5 and say 8 GB RAM and your 512 GB storage, right? Hard disk. This is ideal. In case if you want to cut down the cost, instead of i5, one can go for i3, not a big problem. But if you're going for laptop, do add a writing pad. Right? A writing pad. You must have Googled also. Right? On Amazon, that sale was going on. So even those Huan iPads, they were available at the cost of about 5,000 rupees. Worth it. Right? It was worth it. If you're going for iPad, yes, iPad 512 GB, it would be costly. Yes, it is good. So it totally depends upon the budget. My preference, I would always go for laptop. Initially, a laptop hai aapke paas, and then also you want to add something to it. Yes, iPad is definitely good. Samsung tablets, can one take? Surely can take. No problems. So that is the thing. Next, fitness session. Fitness session, aaj ke liye kuch nahi, because even I'm getting few other questions, but it would be on Saturday. All the fitness questions, whether you want to gain weight or you want to lose weight, you want to increase your muscle mass, everything, endurance, sub. We'll be talking about the supplements also, right, which are needed, whether to take it or not, all on this Saturday. Right? So today is what, 15? So 17, 19, 19th. On 19th, we'll be discussing. Very important to all those to whom I have not answered. If your vitamin D3 is less than 20, तो boss, this is, मतलब कहाँ? I have to ask, यार सोमालिया में रहते हो? Don't you eat properly? When your B12 is less than say 250, so it is a crime. It is a crime. When you are spending so much money for the studies and everything, you खाने पीने में क्या कंजूसी करते हो? Right? Anyway, if this is the situation, you must take these. That's a treatment. For vitamin D3, if it is less, so you need to take tablet, what is called as the cholecalciferol. Right? It is available in various strengths. You have to go for 60,000, 60K IU stands for international unit. Now, ये ध्यान से सुनना. I'm just making some space. If your D3 level is less than 10, there were more than 5 persons whose D3 level was less than 10, right? That means they are very much prone for fracture, right? Very much prone for fracture. Kahin laga, gire, chot lagi, or fracture ho gaya. So in that case, you have to take this tablet twice a week. So I'm writing it like, say, Sunday and Thursday. Any 2 days you select, keeping a gap of 2 days. So don't send a mail for, okay, can I take it on Monday and Friday? Yes, you can. Okay? But if it is less than 10, so Sunday, Thursday. If it is between 10 to 20, then you can take it once per week. You have to continue it for how many months? Minimum 3 months. Minimum 3 months. Right? So I'm writing 3 months. How much would be the cost? If you go for Pfizer, and the cost will be skyrocket. No need to go for such anything. Cipla, Cadila, right? Torrent Farm. All these Indian companies, it will be costing about 65 rupees for 4 tablets. For 4 tablets. So if you're taking once a week, so it will cost you 65 rupees per month. If you're taking twice a week, so then it will be costing 130 rupees per month. Bus. This is the cost, right? So this is one. Second, for B12, if B12 is less than 250, B12 will be affecting your brain. So this is tablet. This I'm writing sub-neuro. Because there is one tablet which is available sublingually. Sublingual means you can put it under the tongue. But that was not available in some of the areas. But this is easily available. No problem. You can take this also. It is 1500 mcg per day. It is a water-soluble vitamin, so you have to take every day. And this is to be continued. Chalu hi rakho. If it is less than 250, we need to reach to the level of 800, 700, 800 tak hona chahiye. That is the best. That is the best when your brain would function lavishly. So, and there is no side effect because it is water soluble. Even kabhi mood hua, 5-6 goliyan bhi khali, no problem. It will pass away in urine. Right? Water soluble vitamin. There is no toxicity recorded, subject to someone eats it like nashta. Right? So not to worry. So this is one. Spreader, amazing responses. Amazing. Literally amazing. Many of you have reached almost 490. Now, one thing very interestingly someone said, right? Okay, in iPad, so normally on computer when you do, so there is increment and decrement of plus or minus 25, right? But on iPad, you can set the number. So that was a new thing. I was not knowing it. So thank you. But as you said that you reached to the level of 490, awesome. This is just amazing. Very nice. Right? And that shows your consistency. And someone, if you are at 150, तो यार depressed क्यों होती है? Right? किया ना, मतलब it is like you are fighting against yourself. So one day you will reach to 1000. So no worries. You are working against yourself. Right? Someone very, very interestingly wrote Rudrani versus Rudrani. Right? It is exactly. It is like you versus you only. After that, what? After that, you'll be going for keywords. Right? Yes, we'll take that speed reading session half, right? On any of the day, half of our session will be dedicated to the speed reading again. So where I'll be explaining these keywords, etc. again. But those who have already learned that, so focus on the keyword who, what, where, when, right? Just on these keywords. Try to find out the answer of who, what, where, and when. These are one-word answer, and you should be able to pick it up very fast. That is the object, what he or she is doing, what is the time duration, time frame, anything given in the form of minutes, seconds, hours, days, weeks, months, years, centuries. All these are related to time and when. When is the place? So that is how we'll be proceeding. Now comes the most important part, this one. That what are the associated planes, right? What are the associated planes? Yeah, those who have completed the MBBS abroad, they have got no value. Don't even let these thoughts come into your mind. What really matters is how good are you. Baki otherwise, आपने MBBS की डिग्री लगा के रखी, right? After that, you'll be doing something. पता है क्या होता है? This is as a doctor when you are sitting. 2 minutes में, within 2 minutes, patient को पता चल जाता है कि इनको आता है या ये ऐसे ही बैठे हैं. In civil hospital, if you go ना, तो वो patient क्या बोलते हैं? वो because there are 1,000 patients in queue and there are 7 doctors sitting. तो वो adjust करते हैं अपनी position कि नहीं इस डॉक्टर के पास नहीं जाना, इसके पास जाना है. They actually do that. How do they know? Are they so intelligent? No, it is that intuition. पता चल जाता है. Example, कभी सितार वादन या संतूर वादन या कोई गिटार बजा रहा हो सुना होगा, right? Even if you are not good, even if we are not knowing that this is राग बागेश्वरी or this is राग भोपाली, नहीं पता, right? कि इसके अंदर पौ वर्ज ये है, नहीं कुछ नहीं पता. We don't know that. But सुन रहे हैं, and in case if he plays a wrong note, it registers into your brain कि बस कुछ तो गलत हुआ. क्या गलत हुआ नहीं पता चला. तो पता चला कि there was something wrong because brain senses that tune. This is vital in medical practice. Vital. कितनी बार, as you'll be coming into practice and the way you write your emails, right? It is very easy to judge what type of person are you. मैंने कुछ लोगों को बुरा मत मानना, मैंने थोड़ा harsh भी लिखा है, right? और I'm very sorry, मैंने एक जो गलती से लिख दिया, पर when the mail was sent, then I found कि मैंने ऐसा लिख दिया कि साले इतना नहीं पता चलता, मैंने ऐसा लिख दिया. So I'm really sorry. ऐसा मेरे दिमाग में नहीं था कि गाली बोलना, पर मैंने लिख दिया है, right? So I don't know whether you must be there, but बुरा मत मानना, right? Because I didn't get the reply from you after that, but it was a bit unintentional. What you wrote is to my meaning was कि यार अपने आप पे विश्वास रख. Something. Okay. Current sugar level is 79. You tested it right now. Test किया तो खा लो या मिठाई खा लो. Eat something, chocolate रखो. Right? Chalo, coming back to this superior, inferior, anterior, posterior, medial, lateral, and how are they associated with the plane? I won't reply. You will reply. Right? There were 3 planes. One, ye nose. We are watching from the top. Right? So the plane which is dividing the body into anterior and posterior, is plane ka naam kya?
Coronal plane.
Coronal plane, right? From the word crown. So if it is divided into anterior, posterior, right? So that means anterior, posterior is associated with coronal plane. Correct? So easy. So that is done. Acha. What name would you give? Who is dividing the body into superior and inferior?
Lateral spleen.
Transverse.
Horizontal.
Transverse plane.
Transverse plane.
Yes.
Transverse plane.
So whether it is dividing the body into upper or lower, so it is the transverse plane, horizontal plane, right? So we'll just write transverse. You are 100% right. Transverse plane. And last thing?
Sagittal plane.
Very good.
Sagittal.
Right. So it is the sagittal plane.
And then parasagittal if it is slightly towards the other sides.
Radial plane.
Exactly. Right. So sagittal is also called as the median plane. Right. It is the median, right? Median, right? Or
Sir,
median.
isn't the transfers also called as axial?
It is called sections, right? So the thing is, these are fixed planes. Now, anything which is parallel to it, say for example, sag plane or the sagittal plane, right? So this sagittal plane, we'll be drawing it like this, right? So when it is going like this, to all these planes which are parallel to it,
Parasagittal.
yes, we'll be calling them para. So whenever the word parasagittal comes, so para means it is either on the left side or on the right side. So we have to define that this is a parasagittal plane, which is at the distance of, say, 10 millimeter on right side. 10 millimeter kahan pe? Obviously from the sagittal, right? Where these terms will come, till you will be doing the radiology, these words will not come. Because in radiology, when you are on machine, you are going for the, let's say, first you'll take a section on sagittal, and then you'll say, okay, increment it by 5 mm on right side. So dug, 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 dug. That sound when comes, it is the movement of that motor, right, which is shifting the sensors at a distance of 5 mm. So every 5 mm there is a section, right? And then it will be written 5 mm, 10 mm, 15 mm, 20 mm. So that means if it is on the right side, you'll just see and you'll be able to identify. And so it is on the right side. Similarly, it is done on the left side also. Right? So that is called as the parasagittal. Can we take it paramedial plane? हाँ, बोल तो सकते हैं, right? बोल तो सकते हैं. Parasagittal is normally, but the paramedial plane वो कैसा हो गया? It is like telling कि he is husband of my mother, right? अब daddy बोलो ना. ठीक है, technically that is also right, husband of my mother, but that's the difference. Right? So sagittal and parasagittal, they are better. So I hope this thing clarifies. In case if you are missing any of the previous lectures, or or if you want to go to previous lectures, or right, so then go to this my YouTube channel. There all the things are there. Even today's session is also there, right? So you'll be getting it. हाँ, initially जो question answer होंगे वो थोड़े अलग होंगे, but yes, you'll get the main crux. So I would insist कि हाँ यहीं पे मिल लीजिए, but in case कुछ miss हो गया, तो you don't miss at least the content of it, right? What if after first year? दोस्त पहले first year खत्म करो, right? My intention is to just teach you till you become MBBS. The trouble is, watch the number. Today the number is what? 315, right? How much was it last time? It reached to 385. कहाँ गए 70 लोग, 70 people, right? And कैसी कैसी email भेजते हो, and जो भेजने वाले वो आप लोग हो ही नहीं, right? Okay. महान आत्माओं ने ऐसे भी मेल भेजे कि मैं तो सवेरे 11 बजे उठता हूँ, तो फिर आपके लिए स्पेशल सेशन अभी पॉसिबल नहीं होगा, राइट? स्टडी प्लान्स फॉर MBBS, स्टडी प्लान अभी कुछ नहीं, फॉर नेक्स्ट 3 months, right? I would say that I'll be conditioning you. Conditioning means before the military training, right? Before the commando training, initial stage is conditioning. You want to go to the Everest, the base pay, first base. On base you reach and then you get conditioned, right? So that mentally and physically you are fit enough. फिर ऐसी बोरियत नहीं होनी चाहिए, अरे 2 घंटे चला लेक्चर, नहीं 2 क्या 3 घंटे भी चलेगा, right? Even it will last for 3 hours. And yes, if I teach, then you should be able to give complete focus. बीच में किसी को लगे अरे मैं थक गई, कॉफी पीनी है, ठीक है चलो 10 मिनट ब्रेक, but session will continue over here. We'll talk about something else, but ऐसा नहीं कि चलो we take a break. Break means session ही बंद किया and then no. Yeah, right. We'll remain online, but we'll keep a break. वो interval जैसा, ठीक है? So that is, and then all the way up to MBBS. So don't have any doubt on that. The question is regarding anything about the personal training. Yes, I give personal training, but जब ये free मिल रहा है तो free लो ना यार. Why do you want that? Then I'll definitely tell you about it when needed. अभी नहीं जरूरत. You don't have to spend anything. Okay? So that's right. One, regarding the daily diary, I should say must for everyone. If you have not started, start it from today. As I showed you, right? Say this diary. This is a new diary which I have started, right? कितना फायदा हुआ, बताए? There is some renovation going on. तो कुछ चीजें जो लेनी थी, ये मैंने पहले लिस्ट करके रख दी थी. That moment that prime days came, so 12 to 14, right? उसमें खरीदा, कितना फायदा हुआ. In some of the things जो टैप होते हैं नल, 300 रुपए का फर्क आया. So why not? Means every rupee counts. But this is the diary. Write everything. Bindas likho. And two things you should keep in mind. One, what will you do tomorrow? रात को सोने से पहले, right? So that is what is called as the tomorrow's plan. मतलब कल रात को मैंने जो लिखा कि आज वो पस्ती वाले को बुलाना है. क्यों? वो पता है, when you मतलब घर में ना इतना कचरा भर गया होता है, वो प्लास्टिक का डब्बा, ये वो फालतू में जिंदगी में कभी यूज नहीं किए, वो सब पड़े रहते हैं. सब उठा के आज निकाल देंगे, so that you get some space. So ऐसे फालतू काम भी लिखो, so that it gets done, right? And second thing, your consistency. Say अभी fitness की बात नहीं की, so that's why. Otherwise, I always write my say fitness plan. रात को कल देर तक ये movie, I was watching the movie The 33, right? In which 33 people, they get trapped into that mine, and it's a very good movie. But वो देर हो गई कल. So that, but still no change. 4 बजे तो seriously आज ऐसा हो रहा था कि यार आज सो लेते हैं, but no. 4:05, 5 मिनट एक्स्ट्रा सोए, and then कि can this clock defeat me right in the beginning? दिन शुरू कर रहे हैं, this clock is defeating. नहीं, चलो let's start, and then went for a run. So ये जरूर लिखो कि this thing is what I'll definitely do. बस बाकी अपना रूटीन लिखते रहो. It will be very important what you eat, but that would be with perspective जब फिटनेस की बात करेंगे, because what you eat, it matters a lot. It matters a lot if you want to increase your weight or decrease your weight. Right? It is not a big rocket science, and being medico, so it will be very easy for me, easy for you. मतलब क्योंकि यहाँ पे YouTube पे तो कुछ भी, मतलब द टाइटल ही ऐसा मारते हैं, 8 किलो वजन कम करे 1 वीक में, and then they claim like anything. क्या मजाक. एक बंदा तो बड़ा मतलब गट्सी था. The title, I think I'll show you that. He said 6 घंटे में 3 किलो वजन कम करें. 6 घंटे में, मतलब, and the views were in millions. और अंदर उसने लिखा कि ये एक्सरसाइज करने, एक्सरसाइज कि आपको कम से कम 6 घंटे के अंदर you have to run 21 kilometers, और आप इतनी डिप्स मारो, इतना वेट उठाओ. अब when you calculate, तो then if it is totally utter nonsense. Because in order to reduce 400 grams, that is 1 pound, there has to be the calorie deficit of 3,500 calorie deficit. Ab when it comes to 3 kilogram, right? 3 kilogram, so that will come to what? That will come to, if you calculate it, मतलब 1 kilo वजन कम करने के लिए, there should be the deficit of about 9,000 calories. 27,000 calories deficit. Can you burn this much? मर जाएगा आदमी. So all पता नहीं क्या कैसे बनाते हैं वीडियोस, but still see people see that. And the final thing, so you ask for the cell phone number. See, you understand, even right now, you see there are more than 46 emails. It will take so much time. If I give cell number, I won't be able to reply you properly, right? And then you will feel bit bad कि मैंने मैसेज भेजा तो भी 2 दिन से रिप्लाई नहीं किया. So deliberately I'm not giving. It's not so that I have not given my cell number to anyone. In case of any of the emergency या ऐसी कोई situation बहुत vital हो, and झूठ मूठ में मेल मत भेजना कि बस मुझे तो नहीं जीना. right? In some say extreme cases, I have given the cell number because they were on the verge of committing suicide. ऐसे भी थे. And by God's grace, they are doing well now in their final MBBS. So, but and it's not so that मैं नहीं देता number, but then it is like a request to you. Number low, no problem. But when it is like एकदम dire emergency है, तो वो good morning message मत भेजा करो. वो मैं बोलता हूँ. Because it looks, मुझे भी खराब लगता है कि यार इतने प्रेम से भेजा किसी ने good morning and I am not even replying. ठीक है. बर्थडे का कोई प्रॉब्लम नहीं, right? It is 30th May. So चली गई. अभी तो अब next year. Hobbies बहुत सारी है. Right? So we'll keep on talking about it. One gutsy fellow, right? Ask कि आपकी कोई girlfriend भी थी क्या? Why past tense? So I think I answered that. तो क्यों नहीं होगी? कि नहीं होनी चाहिए? पता नहीं. चलो. हाँ संकेत. Yes, Ankit.
Sir, I have sent you an email. So, उसमें means I sent it yesterday. So I want to वो vertical reference point, vertical axis का reference point कैसे लिया? तो I don't get it.
Can you clarify क्या था? कल भेजी थी मेल.
Sir, I was in the Gray's anatomy. So as you said, horizontal plane divides body in superior and inferior part.
True.
So in same page, तो उसमें it was कि superior and inferior plane are मतलब they are divided by.
Okay, got it. What you are asking? I got it. Right. So this is like long axis of the body, right? Long axis of the body. Okay. So long axis with relation to your anatomical position. So when you are watching straight, right, both hands like this, that is a long axis. When you say superior and inferior, so from what level? Now see, it is like यहाँ से भी ये superior हुआ and this is inferior, right? This is the superior part and this is inferior part. Okay. But what if you cut it from here? So again, this is superior, this is inferior. You know? So yes, it is a relative term. It is a relative term. Where is it used? It is used in that reference. Say, for example, when we are discussing head and neck. So in head and neck, we are talking about, let's say, nasal concha. That means this is the nose, right? And in this, there are three cartilaginous structures. So there is superior concha, inferior concha, and middle concha. Middle, right? So here it is in relation to each other. कि कौन ऊपर है? Superior also means cranial, towards the head side. Bas. Right? So superior means one which is above. If there are many times, there will be, say, muscles. So this is one above, one below, right? And we call it superior rectus, inferior rectus. Means this muscle is above, this muscle is below. Okay. So let's start with our skeletal system today. So here, when we say skeletal system, it is about bone and cartilage. Right? Bone and cartilage. So when the bones, whenever you come across the word osteo, so osteology. So the skeletal system is also called as the osteology. That means the study of bones. We are talking about the study of bones. So, and when it is pinea means thin. I'll show you some of the x-rays also. Yeah, I put some of the x-rays. Those x-rays, they are not present into that PDF, which was, say, on YouTube, right? So this would be a bit extra. So we'll be diagnosing one condition also. So this is, pinea means thin bones. So if anything is thin, so then on x-ray, you'll be able to see that, right? Okay, this is thin bone and this is a normal bone. How will we see? Practically, we'll see that, right? I'll show you a normal x-ray And then I'll show you one osteopenic state. So you'll be able to find it. Bone and cartilage, they are called as the connective tissue. The bone is tough, right? And the cartilage is relatively soft, but as such tough. Cartilage, hold your nose and try to feel, right? In the nose, there is cartilage. In the ears, there is cartilage, right? Skin, say skin kaisi hai? That is very thin, right? But when you touch your ears, when you touch your nose, so it is in between. That is where the cartilage is there, right? So that is cartilage. Bones, they are the bones. In bones, we'll be getting calcium salts, phosphate and carbonate. So calcium phosphate, calcium carbonate, they are the vital important salts. These are the salts which will be required for the constant turnover of calcium. Turnover means use hua, naya aaya. Use hua, naya aaya. So that means that bone is a live structure. Bone as a dead nahi hai. Bone is a live structure. Constantly it is getting remodeled. And proof, fracture. If there is fracture, so then what orthopedic surgeon is doing? Orthopedic surgeon is just aligning that fracture. The rest is done by God. Rest is done by our body, metabolic system. So that bone, it goes into the state of remodeling, and that broken part, because they are opposed to each other, it takes time. If the clavicle fracture, 3 weeks. If it is a big fracture, so then maybe 6 weeks. But ho to jata hai. Whenever we'll be discussing the fracture, this is the symbol of fracture. So it would be written like, say, fracture, clavicle, L. That means lateral 1/3. So here is the midline, and that's the clavicle. It means the fracture is at this point, right? So when it is written like this, but more when we'll be discussing clavicle, but clavicle ka fracture, so we'll be having this symbol. So don't say hashtag clavicle. No, it is like fracture clavicle. Constant turnover of growth, because height increases, so it is the growth. So that means bones are growing, bones are becoming bigger and bigger and bigger. Bones, they mold themselves, right? And we'll see some of the things. There is atrophy. Atrophy means kuch log, when they walk, right? So they walk like that Sanjay Dutt. No? Bhai aise aise karke mud aise. So there is like a hump. As अब ये स्टाइल धीरे धीरे आगे चलती है ना, तो देन फाइनली तो फिर ऐसे मुड़ जाते हैं, राइट? स्टिक पे आ जाते हैं. So this is, it's because of pressure, those vertebrae, they start changing their shapes, right? So that means pressure matters a lot. There is
atrophy means loss of something, no? Like
loss of
muscle
atrophy means decreased. Yes, atrophy is decreased. So it means that when, say, they start getting deformed, and in between there is intervertebral disc, and then these intervertebral discs, when they start getting atrophied, matlab wo thin hote khatam ho gayi. So then
disintegrates. Okay, sir.
There's disintegrate, right? And it leads to so many complications. So this is atrophy. Then there can be hypertrophy. Hypertrophy, that is when it becomes bigger, right? It's bigger. So there are various reasons. When the muscle, they become big, when the bones, they become more powerful, bigger, because bones, they understand the language, only 2 languages, stress and pressure. Tension wala stress nahi. If you pull it, right, then that bone will become bigger. If you press, if you give pressure, so then there'll be multiple layers, it will be more powerful. So that's why when you are going with heavyweight lifting, right, so obviously your chest will automatically become more and more powerful, right? But it should be exactly at that optimum level so that it should not break, right? Injury-free exercise, that would be our prime motto on Saturday when we'll be discussing it. And we'll discuss both isometric, isotonic. We'll discuss for what is good for males, what is good for females, right? And those answer to those 2 emails that regarding, बड़ी अच्छी लैंग्वेज में बोल रहा हूँ, रिगार्डिंग द इंटीमेसी थिंग व्हाट वी आर डिस्कसिंग, जो सभी मैंने बात ही नहीं की थी, राइट? विल बी डिस्कसिंग दिस टॉपिक आल्सो इन डेप्थ एंड इट इज कंपल्सरी, राइट? आई वुड इंसिस्ट कि उस दिन रहना, राइट? यू विल थैंक मी ऑन दैट स्पेशल डे, ठीक है? बिकॉज सीरियसली व्हेन यू आस्क दिस क्वेश्चन, राइट, आस्क एनी, यहाँ पे मतलब सो मेनी ब्यूटीफुल फीमेल्स मस्ट बी हियर, ठीक है? आस्क देम engine driver ka cousin ban rahe ho, that is when you are smoking, are they impressed? Forget about those idiotic advertisements. Ask a female. Do they like such males कि वो फूफू cigarette पी रहे हैं, right? पूछ लेना. Okay. तो बंद कर दो.
Excuse me, sir.
हाँ.
Sir, the lecturer general anatomy which are on YouTube are the same which you are teaching us.
Sorry. What were you asked regarding the general anatomy? क्या?
Sir, जो lectures YouTube पे है वही है क्या ये सब?
हाँ. Say you will go to YouTube and when you will go for the playlist, in playlist general anatomy.
Another teacher, sir. Another.
I missed. What did you say? Okay. So, right, bone has got tremendous regenerative power. Blood is the best.
Excuse me, sir. Sir, can you explain the atrophy part?
Atrophy means loss, decreased, right? If you don't exercise, so muscle kaise chote ho gaye, patle ho gaye. So that is a loss, decreased. When things are decreased, right? And as you exercise, the muscles will become bigger. So that is the hypertrophy. Right? So when in decrease in size or increase in size. So atrophy is the reverse of hypertrophy. In fact, trophy means growth, decreased growth or increased growth. Blood is best. You donate the blood and the speed at which the blood regenerates, right? Its regenerative power is tremendous. Bone says they have also got the great regenerative power. This was about why it is important. Well, when you are standing on stage, it is your structure, right, which will be revealing your body language. This is vital. Iske upar more on Saturday. We'll talk about it. So bones, they form the framework of the body. In general, you should really be having a rough idea about how many bones and which are the bones which are present. This is how we'll be studying all these bones. One, which is your face. On face, see, there are 14 bones. Itne chote bones. Is it necessary to remember all those names? Yes, when it will come to the head and neck. Abhi ke liye koi tension mat lijiye. So that is face. What I wanted to say was, important part was, one is the face and second is the cranium, khopdi, right? So this is the khopdi. In that there are 8 bones. This is frontal, parietal, right? Then temporal, occipital. So they just make the skull cap, and inside there is brain. So all these bones, right, they are very tough because their function is to protect the brain. But when the baby is born, so there are some khaddas, right? They are called as the fontanelli. They are called as fontanelli. And person would be, when in clinics, they are very much tempted. Kitna soft hai. Are nahi bhai. Never touch that area because you can straight away touch the brain and you can damage the brain. And because it is the cerebrum, बच्चे को अभी पता नहीं चलेगा, but if the cerebrum is damaged, it will lead to motor deficiency or the motor problems, and that thing can occur to kid. So never ever those areas, anterior fontanelli, posterior fontanelli, because there are, so when you watch from the top, so if it is, this is the skull, so you will find that these are the areas which are open. So these are the all those sutures, they are called as the sutures. Gradually, as the age increases, right, they fuse and then they make it a hard skull. It's important.
Sir, I have seen like Indian parents massage the baby oil, massage the head with baby oil and all. But if it's not allowed to touch, then why are they doing that?
No, it is a very good thing, right? Good question. They don't massage like, yaar, yahan pe dard hua to aise gol ghuma ke, not that pehlwan type massage, right? The massage which is done is if this is the skull, so then put the oil and then they do it like this.
Tapping motion, yes.
So that is okay. That is okay. And in fact, it is a very brainy thing, very intelligent thing. So as we'll progress, you will find that, yaar, ye apne ये दादा परदादा क्या जीनियस रहे होंगे, मतलब they must be knowing this anatomy so well, right? So that is.
And so what's the benefit of doing that?
वो हेड एंड नेक में डिस्कस करेंगे. The only thing is it improves circulation. चलो, I will finish it. It improves circulation of the scalp, right? You
Sir?
कभी कभी कुछ याद नहीं आ रहा तो पता है अरे यार क्या था, right? What do you do, like ऐसे क्या था ये क्या, what are you doing? You are just doing, you are increasing the circulation, and those vessels, they actually go deep, they traverse throughout the scalp, cranium, and then they reach to the brain. So that is how you are trying to increase the blood supply. When you say अरे कल बोला था तो छोटा दिमाग, right? नाना पाटेकर, right? यहाँ नहीं मारने का, छोटा दिमाग होता, right? But yes, that is the thing, because it is important. रात को कई बार सोते हैं यार ये क्या आंसर नहीं पता चला. Next morning when you wake up, suddenly you get the clue कि हाँ, this is how it is to be done. So that is cerebellum which is working. That cerebellum, that छोटा दिमाग, right? Cerebellum is slow, but when it gives the decision, it is top of the world. So that is the thing. And so these are on phase 14 bones, hyoid, right? This bone, right? So there is one bone. Then clavicles, right? Also called as the beauty bone, right? Especially Korea serial में तो मतलब इतने full clavicles दिखते हैं. But it is not so कि जिनके नहीं दिखते वो, those females, they are not beautiful. No, it is not so. But this is how it is divided, right? It is important is in ear, कान में, right? There are 3 bones. These are the smallest bones. This is external ear, this is inner ear. One of the most fantastic and most fascinating thing about human body, our auditory system, right? कहने को कान का shape, so that it can catch all those waves, focus, and then send it. So यहाँ से जो आवाज गई, it goes into the external ear, right? This external ear, जो कान में उंगली डाल के, right? When you clear, so this is that external ear, external cave. Then over here, commonly called as कान का पर्दा, right? This is that membrane, tympanic membrane, right? That tympanic membrane which vibrates, right? Which vibrates. And then there are 3 bones inside. 3 bones inside. Malleus, incus, stapes. Malleus, incus, stapes. Wonderful things about all these bones. But the idea is that small vibration, how to amplify, right? So that is connected with small hammer, then it is connected with bigger bones, still bigger bones, so that when this vibrates slightly, then it will be, that vibration is multiplied, and here there is a fluid. It is connected with a window. जिसके दूसरी side पे there is a fluid. Right? This is the inner ear, in which there is vestibulocochlear apparatus, and then it will vibrate. So when it will vibrate, so it will generate waves into that fluid. Now when it will generate waves into the fluid, right? So this is vestibulocochlear. There are small, all those sensors over there. So when the waves are there, so these sensors, they will move. When these sensors will move, so they are connected from here, right, to the nerve, vestibulocochlear nerve, right? So that nerve, which will be carrying, it is the 8th cranial nerve. There are 12 cranial nerves. This is the 8th cranial nerve, divided into 2 parts, vestibulo and cochlear. So it is this vestibular nerve which will be taking it to the auditory cortex. This is a part of the brain. That brain which will analyze कि हाँ ये waves आई इस frequency पे, this was the pitch, and then it will tell to the other parts of the brain, right? कि बस ये क्या आवाज थी? They will say, let me check, right? They will synthesize the protein chain and they'll say, अच्छा, this is the voice of lion. वो lion बोला. So then it will send this message to visual cortex. So there will be a picture of lion. आँख में से भी message गया, which will go to visual cortex कि सामने lion खड़ा है, and then both the things will be combined, and it will send the message to the cerebral cortex कि बस ये खा जाएगा, भाग. And then you start taking the action. This is how the whole thing goes, right? So this is the 3rd inner ear. And the beauty is this malleus incus stapes, middle ear infection, because middle ear is connected with your throat. That's why when you go onto the flight, यार कान बंद हो गए. And वो air hostess, right? पहले आप तो देती भी नहीं है, मतलब पहले, right? Smile के साथ, plastic smile. right? वो आपको chocolate देते थे कि हाँ chocolate लो, right? Because when you suck, right? When you drink, अभी पानी देते हैं. So when you drink anything, so when you swallow, so this keeps your tube, which is called as the Eustachian tube. Eustachian tube, right? So this tube remains open because this is like a pressure balance. So that जो popping sensation आती है कान में, कई बार कान में ऐसे यूं करते हैं, then you feel कि हाँ अब ठीक है. So it is this Eustachian tube opens, and when this tube is blocked, especially when the person is having cold, तो कहते हैं कि वो मतलब common cold, right? खांसी आ रही है पर कान में भी दर्द हो रहा है. It is because the pressure in the middle ear that is not getting adjusted, right? So it is the tube which was balancing this pressure. This tube is blocked. So whenever there is pharyngitis, right? Because this is the pharyngeal tube. When this pharyngitis, itis means inflammation of pharynx. It blocks this tube. So then you'll find the pain is in both the ears because the tube दोनों side की block हुई. So that is how you diagnose. If it is only on one side, you say that it is a focal infection. एक जगह infection है, right? Because opposite side there is no pain. Pain is only on one side. So easy to judge, right? More when we'll be discussing head and neck. But the beauty is malleus incus. These are the very small, very cute, beautiful bones, but they are the bones which are those who are having apple, right? They say you go to this Apple Music and then there's an option spatial audio. It is not spatial, but it is spatial audio. Spatial audio is when you put those iPods and when you play that spatial audio music, it won't be coming. You will forget like whether it is coming from right side or left side. The music would be generated into your brain. तो जैसे brain में drums बज रहे हैं, right? As if the whole orchestra is around you. Similarly, the Bose system, right? When they say, I love the audio industry. When I was in 12th standard, I created my 24 channel graphic equalizer. So it is like when typical लड़की horror film में, right? करके जो चीख मारती है, तो that चीख, those speakers, they were specifically designed for those higher frequency और वो सोफा के अंदर रखे थे, right? I created everything और फिर मम्मी डैडी को बिठाया कि देखो अभी मूवी देखते हैं, right? Movie was, I still remember, it was Evil Dead. और वो जब वो लड़की चीख मारती है, मेरी मम्मी ने इतना गुस्से हुई थी क्योंकि दैट चीख वॉज वो वॉल्यूम ज्यादा रह गया था, तो इतने जोर से चीख मारे और इट वाज राइट बिल्कुल पीछे से, तो इतना जोर से उछले थे सब. बट दिस इज सो इन बोथ सिस्टम they generate that specific sound. So when the helicopter is moving, right, on the screen, it is going from right to left, so then ठीक है, right to left panning of music. But when the helicopter is hovering, you will feel like helicopter is hovering over here. There is no speaker. They are called as the virtual speakers, right? So those rest of the speakers, they will say create the sound in such a way that your whole room would be filled with sound. So if the machine gun is getting fired, right, and they're the target, so yes, machine gun is fired over there, and वहां से करके वो गिरा उधर, right? So you'll be able to feel as if the whole thing is. Same way when the music is getting generated, so those pods, they will be generating with such frequency that the sound is actually produced into your brain, right? So that is what is called as the spatial audio, or the SPATIAL, spatial audio. All right. Here it is another thing about this part, that is what is called as the sternum. It is the sternum. Apparently, no part of the brain should be touched. कोई specific नहीं, पर यहाँ पे जो है, it is the, when we'll be discussing head and neck, right, we'll talk about it. But no part of the brain should be ever touched. हाँ, ये सारे bones के नाम याद रखने हैं. Yes, it is necessary. So this is sternum. Sternum is this bone, right, which is right in the middle, is over here. And top one, this part, right, I have not written the name, it is manubrium. As such, manubrium is part of the whole sternum only. That's why, right, it is called as the manubrium sternum. Then on the back side, we have got what is called as the scapula. Right? Scapula, back side. When you tap yourself, right, so that is this, you are touching the scapula. Now try to touch the scapula, you'll find a very prominent ridge here, right? Prominent ridge. That ridge, just keep in mind, that is the ridge which will be carrying tremendous importance because it is called as the spine of scapula. Spine of scapula. So muscles जो ऊपर होंगे, we'll be calling it Right? Here is the scapula. The ridge which you are feeling, that is the spine. So the muscle which will be above, so ये जो spine है, the muscles which are associated will call as spinatus, because they are related to spine. So यहाँ पे भी एक muscle है, it will also be called as the spinatus. Right? So the muscle which is above the spine, we'll call it superior. So it is called as the supra. Right? Like Rajnikant style, right? Supra. Right? So it is called as the supraspinatus. Right? And so what would be the name which is below?
Infra.
Infraspinatus, right? So it is called as the infraspinatus. But that's how the things go. Right? Now over here, see, it is this which we have taken as the reference. So anything which is above is supra and below is infra. So superior and inferior. So easy, right? So here, this particular plane will be passing through a different level, but horizontal plane, because spines are horizontal. Okay? So that is the scapula. Then old time best, our 24 ribs, 12 on each side, right? And these ribs, they carry so many important functions, right? Breathing, giving protection to the important organs which are inside, etc. Then for the upper limb, this is humerus, right? The humerus, the arm, right? This part. So that is the arm. Then we have got two bones into our forearm. They are called as the radius and ulna. I've written it on this side. So we have got two radius and two ulna, that is right and left, right? So right and left. So outer one, it is the radius. Pata kaise chale? When you take the pulse, when the hand is into your anatomical position, you take the pulse. You always take the pulse on the outer aspect, right? You should be able to take your pulse. You should be able to feel your pulse on the radial aspect very easily. Reason? There is a bone. Immediately on that there is artery, right? So when there is a strong support behind, so you put a finger, so you'll be able to feel the thrust. There is artery on opposite side also, ulnar artery, but it is very difficult to feel the pulse of it because it is just underneath that artery there is muscle. So when you try to press the artery, you try to feel the artery, that artery will go below, right? Because it is a soft structure, so it won't be giving any rebound phenomena, so you won't be able to feel the pulse very properly as you see it on the radial side, right? Are you feeling your radial pulse? Because it will be important.
Yes, sir.
Yes, sir.
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir.
You should be able to feel
Yes,
your
sir.
carotid pulse also, right? Because जब fitness की बात करेंगे ना, तो that would be much easier, right? When you are running, right? तो दौड़ते भी it is easy to feel the carotid pulse, right? They are more bounding, and carotid is directly connected with the heart straight away, right? It is emerging, so dhan, right? You'll be able to feel the pulse very rapidly. आजकल की सीरियल में दिखाते हैं, मतलब they cut the gala and then धड़ से, right, पूरा blood निकला, मतलब how horrible. I know that is a wonderful animation, but इतना दिखाने की क्या जरूरत? मतलब they show it so ghastly, मतलब all animations, but yes.
So they show like they cut the jugular vein.
अरे carotid, धड़ मतलब वो कौन सा? या भी, he is तो my very favorite actor, like पंकज त्रिपाठी. So वो देखा उसका, ये 4th season है ना, that criminal की.
Yes, sir.
अरे वो
Criminal justice.
Yes. Criminal justice.
so दाग ब्लड निकलता दिखाते हैं. ठीक. But as such, those courtroom scenes, they are good. If anyone is interested, right, for the courtroom scenes, there is one author, there is one character, which is Perry Mason, the series of Perry Mason. You'll feel like it is, the whole story goes, and then half of the book is like courtroom scene, exactly like that serial. Right? And then in the court, when they come up, you'll feel like, yes, ये मुझे पहले क्यों नहीं पता चला. Same like Sherlock Holmes, if you are reading, right? There are, if any one of you interested, just let me know. I'll send you the book. I got the complete means all 54 short stories of Sherlock Holmes, and then there are 5 long stories of Sherlock Holmes, out of which The Hound of Baskervillas, that is very fine, right?
Sir,
Then
Agatha Christie is better than
Agatha Christie is
I
also,
feel.
yes,
Yeah.
Murder on the Orient Express, her one of the best.
Yes, sir. And ABC Murders as well.
बता दे सबको क्या अच्छा ये बुक पढ़ना, राइट? मर्डर ऑन द ओरिएंट एक्सप्रेस में बता ही देते किसने मर्डर किया, कितनी गालियां पड़े.
नहीं सर, नो.
No, sir. No,
प्लॉट
sir.
खराब हो जाएगा.
आई नो
Can we get that?
ये तो बदला लेना हो ना किसी से, तो सेंड दैट पीडीएफ और उसके अंदर लिख के भेजो कि इसने खून किया, अब बेटा पढ़ो. अच्छा, राइट? सो देन कमिंग टू, सो वी टॉक्ड अबाउट humorous, we talked about radius ulna, then there are 8 bones over here, right? Ye wrist, this carpals, that is the wrist. Carpals ke there are 8 bones, right? So 8 into both the wrist, 8 into 2, so 16 bones they are over there. All the males, right, they love remembering this mnemonic. Radhika, as I said that on YouTube, right, you go to my channel and there, whatever the lectures which you missed, you will be getting all the lectures, right? You just go to the playlist, General Anatomy, and in that lecture 1, 2, 3, right, it is there. Okay, so we were coming to this carpals, right? Carpals, they are into 2 rows, 1, 2, 3, 4, 5, 6, 7, 8. Why I said all males, they love remembering this, because its mnemonic is she looks too pretty, try to catch her, right? So actually name of all these bones, she looks too pretty, try to catch her, right? Scaphoid, lunate, trapezium, pisiform, trapezoid, triquetral, capitate and hamate, right? But क्या करें, अब यही था. कॉलेज में पढ़ते थे हम तो जानबूझ के, मतलब तकलीफ ये हो गई थी, एक बार वाइवा में पूछा तो बोल दिया शी लुक्स टू प्रेटी, ट्राई टू कैच हर. ऐसा डांटा था ना सबने कि वो जो करना हो करो, यहाँ पे तो नाम सही बोलो. एंड देन देयर इज वन स्मॉल बोन व्हिच इज कॉल्ड एज pisiform, right? I mean, these are such loving memories na. Pisiform, PC means matar ka dana. That bone is actually size of the matar ka dana. The crucial thing is कि एग्जाम में पूछते हैं, वाइवा में पूछते हैं, टेक द बोन. स्कैफॉइड का तो कॉमनेस्ट पूछते हैं, बिकॉज स्कैफॉइड इज द बोन व्हिच इज यूजुअली ब्रोकन विद व्हेन पर्सन फॉल्स ऑन द आउटस्ट्रेच हैंड. ऐसे गिरे, स्कैफॉइड इज द फर्स्ट बोन, ठक से टूट गया, राइट? पीसीफॉर्म, इट इज अ वेरी स्मॉल बोन, वेरी इनसिग्निफिकेंट. बट व्हेन यू आंसर, आपके सब आंसर सही हो ना, तो बी वेरी हैप्पी, क्योंकि ये जो पीसीफॉर्म है, ऐसे ऐसे क्वेश्चन आए तो जस्ट टैप योरसेल्फ कि हाँ बॉस बढ़िया जा रहा है भाई, तब जाके ऐसे क्वेश्चन पूछे. सर ने पीसीफॉर्म लिया, ऐसे ऊपर हवा में उछला, राइट और लेफ्ट, राइट? नाउ हाथ में दो ना तो भी इट बिकम्स वेरी डिफिकल्ट टू फिगर आउट वेदर दिस बोन इज ऑफ राइट साइड और लेफ्ट साइड. सर ने तो ऐसे गोल घुमा के ऐसे हवा में उछाला, राइट और लेफ्ट. मैंने कहा सर राइट. सर ने चेक किया, इट वाज राइट. तो देन तो फिर तो देन यू आर द बॉस ना, फिर तो आराम से बोलो कि नहीं सर, बिकॉज देयर इज अ ग्रूव ऑन द लेटरल सरफेस व्हिच अटैचेस टू दिस एंड दैट. फिर तो सब नाटक करना, राइट? पर सर को भी पता था, ही वाज वेरी स्मार्ट. इसने कहा ठीक है बेटा, राइट? ये तो जस्ट इट वाज लाइक अ टेस्ट ऑफ योर प्रेजेंस ऑफ माइंड. बट वेरी वेरी नाइस टीचर्स. Unfortunately, हाँ बोलो.
I had a question regarding the ear wala part that you were explaining. So you said that we have like the sensory hair-like structures inside the fluid part. So a deaf person does not have it?
No, it's a very big topic, because see, deafness, it can occur from whether there is tympanic membrane is lost, whether there is infection and some of the bones, either malleus, incus or stapes, those bones, they are gone, right? Whether there is problem into this window, if this window has become stiff, or there is injury into the brain. So all the signals they are going, but brain is unable to process. That is in case if there is any hematoma into the auditory cortex. So it is exactly like circuit. Pankha nahi chal raha, so where is the fault? Switch to wire to pankha. कहीं पे भी fault हो सकता है. So that's why when it comes to neurology, you are actually learning the circuits, right? Medicine is like this only. What your question is like, it is a question of medicine. But yes, very good question. Okay, deafness. But now when you think logically, possible now. कहीं पे भी हो सकता है, right? So,
and then, sir, hearing loss will be gradual, na? So
depends.
maybe the sensory reflex structures are
वो
dying.
depend करता है. वो depend करता है कि if someone, whether it is gradual, it can be sudden. If someone has got accident, वो कान में वो ऐसे कर रहे थे, छींक आई, right? घुस गया, right? Tympanic membrane is damaged. Immediate loss, immediate hearing loss. If there is massive infection got burst हुआ, बीच का bone, incus ही टूट गया, right?
Oh, okay.
Yeah, so immediate. So that's
deafness will be like a spectrum.
So you need to. So that's why history is important. What I'm trying to emphasize is history is important. When you ask whether there is associated common cold, etc., any previous infection, when you go for blood test, watch for WBC count higher, yes, high. So that means body can that WBCs की सेना बढ़ी जा रही है, right, to fight. That means there must be some chronic infection, right? Then you go for whether lymphocytes are more, whether eosinophils are more. So that is when you decipher whether it is allergic or bacterial or viral, right? So that's how you decipher the things.
Sir.
Okay, sir. Thank you.
Sir, can you restore hearing problem?
हाँ,
जैसे कान का पर्दा फट जाता है कभी, तो can we restore that?
हाँ, अभी तो bones भी नहीं बनते हैं. Malleus incus tapes, even they can be made.
Okay, thank you, sir.
Artificial bones. They are called as the prosthesis. So those.
Excuse me, sir.
हाँ.
Sir, regarding carpals, like you said, they're in groups like upper four, downside four. So it can be named as proximal and distal, right?
Yes. Proximal row and distal row. Very right. Very good. 1, 2, 3, 4, 5, 6, 7, 8. So when in anatomical position, right? So head is here, correct? So this will be called as the proximal because it is nearer to the head, and this row will be called as the distal row. Right, so proximal 4 carpals, distal 4 carpals. Right?
And same goes for tarsals?
Same is for tarsals. Same will be for tarsals. Very nice.
Okay, sir.
Good. Very good.
But out.
So now, next comes your palm, right? Your palm. So in palm, the way we have got 5 fingers, so similarly, you have got the 5 bones, and these are the bones when you hold it like this, right? So in palm, so that is your metacarpals. So we have got 5 on both the sides, so that is total 10. They are called as the metacarpals. Metacarpals के बाद आई उंगलियां, phalanges. They are called as the phalanges. That is plural. एक की बात करें तो it will be called as the phalanx. Phalanx, 1, right? So this one finger, it is 1, 2, 3. 3 phalanges. उंगली में 3, यहाँ 3, यहाँ 3, यहाँ 3, अंगूठे में 2. So that's why total number is 14. Right? So 3, 6, 9, 12, 13 and 14. So total 14. 14 phalanges on both the sides. So that makes the total 28. So we have got the 28 phalanges. Now in these 28 phalanges, again proximal distal, right? So this is one ungli, right? Let's say index finger. So यहाँ पे it was connected to that metacarpals. Then phalanx. So this is one phalanx, this is second phalanx, this is third phalanx. नाम देने हैं, क्या नाम देंगे? So this would be नजदीक. So this will be called as the proximal phalanx. This will be called as distal phalanx. Something which is far, one which is, और बीच वाले का middle, right? Simple. Middle phalanx. Got it? Right? Because in anatomical position, it will be like this. So this one, जो नजदीक है, that is proximal phalanx, or last tip, that is the distal phalanx. In between, it will be the middle phalanx. Nafis?
Sir, I have doubt regarding to external ear. There is a presence of a cartilage in external ear,
But sir, not in air pinna. Why, sir? What is reason?
This what is cartilage is not there in
Air pinna.
pinna.
Yes, sir. External ear.
Huh? That is the developmental thing. Because the function of, we'll be deviating a bit, but it doesn't matter. This is the external canal. The structure which is surrounding the canal, its function is to divert all these sound waves towards the external canal, so that sound really gets focused into that. In fact, its formation is like cone. The pinna which is over there, right? It is a loose end. Gradually, it keeps on getting degenerated. It is once again, it is like a vestigial organ, but not for females, right? So all those nice earrings, they are over there only. So this is the cartilaginous part, and this is the skin part. Females गालियां देगी. बोलो.
Sir, in some females, due to क्योंकि मतलब वो बहुत दिन earrings पहनते, so like the cartilage tear, yeah. Or
cartilage tear, वो skin है, right? वो those, and then you need to repair it. Suture लेना पड़ता है. You just
the earlobe tears.
Earlobe tears, right? So it's 1 or 2 suture and that gets repaired. फिर उसके बाद वापस होल करना पड़ता है.
Okay.
हाँ, hearing aids के बारे में जो आपने क्वेश्चन पूछा, मतलब hearing aids, not in every case hearing aids will be helpful, depending upon कहाँ पे damage, right? It's a huge topic because what is called as the air conduction, then there is something what is called as the bone conduction, and you have to perform all those tests, then you have to go for audiometry, right? So right now I'm not going into that detail because they are like full-fledged topics in itself.
Even in yoga, we do pranayam. There are some types of sounds that can be felt on your top of the head.
Yes. All right. So now we move on to the pelvis, and in pelvis.
So one more doubt. So regarding phalanges formula, like we should count from thumb or from the small finger, like that pinky finger.
when it is like this, right? 1, 2, 3, 4.
Like thumb's position will be first or fifth.
Say this is first, but as such, it is always like they are named. Means index finger, long finger, right? This pinky finger, what you said, right? So they are named like that. But I'll show you when we'll be doing the, I'll show you the entire nomenclature, because again, if we'll discuss this, it will come into this lower limb also.
Okay, sir.
So phalanges, right? Then comes to pelvis. In pelvis, this is the most complex region, right? This hip joint. Meantime, there are 26 vertebrae, right? On the back side, there are vertebrae. So there are 26 vertebrae. Then the hip bone, right? Hip bone. Hip bone is a very general name. It is also called as the name. Its another name is innominate. Innominate bone. Innominate means जिसका कोई नाम ही ना हो. Because this is a very complex bone. And this bone is the formation of 3 other bones. So when we'll be discussing hip bone or innominate bone in more detail, so ischium, ilium, pubis, right? So all these areas. So if you are right now sitting, so then the lowest base on which you are sitting is called as the ischium. Ischium, right? So that is what is called as ischium. Then this is the part where those pubic bones they meet, right? So this is the region where those bones they meet, and there are certain joints, right? Then this in between part, right? This one, which is called as the sacrum. So it is a complex bone. It is the irregular bone. It is also one of the irregular bone, because you can't say that it is a long bone. You can't say it is a flat bone. No, it is a very irregular bone. Its shape is very irregular, right? And there is a big difference between male and female pelvis, right? Male and female pelvis. So when a dead body is found, right? And then all the flesh and everything, it has been gone. Only the skeleton is found. So from that you learn in forensic medicine. In fact, we learn it in anatomy only. But in forensic medicine, you go it in a much depth that when you get the bone and from that you take the judgment. Even in radiology, right? You just take the x-rays and from that x-ray, you should be able to take a judgment. Okay, what must be the age of this person? Right? So that is how these bones, they are very helpful because we'll be able to understand the entire developmental aspect of it. Not all these things, they are asked in exam, but they are very interesting. So the way we were having humerus, similarly, this is the femur. Femur is the bone of the thigh bone. Very powerful bone, right? Then that is patella. Patella is also called as the kneecap, right? Kneecap. When you touch your knee in anterior portion, front, so the bone which you feel it is called as the patella. Then these two bones, this and this, the way we were having radius ulna, similarly over here, this is the fibula and the tibia. Fibula is feeble. Feeble ka matlab bahut chara nazuk, right? Patla bone. So that is this bone. Actually, it is very thin, pencil-like bone. Uska diagnosis kaisa, right or left? Hold it like pencil or hold it like pencil. Right hand mein pencil ki tarah pakad ke, if you can write with fibula, so that is right-sided. Left side में पकड़ो और left side की pen जैसा लगे तो it is left-sided fibula. So easy to diagnose, right? We'll study this. Similarly, the thick, that powerful, when you touch your shin, right? When you touch your shin, this is the area. The bone which you feel, that strong, powerful ridge which you feel, that is the tibia, right? किसी को पैर पे लात मारो इतना दर्द होता है यहाँ पे because that bone is just subcutaneous. उसके ऊपर सिर्फ skin ही है, there is no tissue. So if the bone is hit, that's why in martial art, that side kick, when it is hit at this point, right? Very important for the females, right? They should know because when they hit, if someone is misbehaving, hit at this point, that shin, it gives tremendous amount of pain. That pain generation, that is so high, right? That this person won't be able to stand. Right? Because there are certain spots, there are 6 certain spots into the human body which are extremely painful. That's why देखा पुलिस मारती है, right? तो पांव पे मारती है. At this point, the shin. एक डंडा भी पड़े तो every winter person would remember. It is that much painful, right? Because you are hitting the bone directly. In
Sir,
many of
tibia is anterior.
feel it.
Sir?
So radial and medial term can be used.
Lateral and medial.
Lateral and medial.
Lateral and medial. Lateral and medial, not radial. Radial and ulnar. Radial and ulnar, so they are for upper limb, right?
Tibia is medial.
And so this is what I was coming to, that in anatomical position, right? In anatomical position, so this bone would be medial, correct? And this fibula would be lateral.
So like lateral border, medial border.
Similarly, there can be lateral border. When you are talking about specific bone, then there will be lateral border and the medial border. There will be anterior border and there can be posterior border. Right? Now you are getting the knack of it. Good. So moving on to the foot. In the foot, the way we were having carpals, now we have got the tarsals. Now you guys are intelligent enough. मैं तो बहुत लोचे मारता हूँ. मतलब टार्सल का कार्पल कर दिया, कार्पल का टार्सल कर दिया. Then one fine day I decided कि नहीं, ये गलती नहीं होनी चाहिए. So I remembered it like tarsals are for टांग. मतलब हिंदी में बोलते हैं ना टांग, पाँव. Right? उसके बाद I have never committed mistake. तो वो वाइवा में कई बार गलती हो जाती थी. So these are called as the tarsals. Tarsals are for टांग, पाँव के लिए. Similarly, there are 7 tarsals. Now these tarsals, they are awesome. Their structure, their alignment is so good. So if you are a runner, and when you start understanding it, how the calcaneum lands on the talus, and how the talus is connected with those medial, lateral, and middle, those cuneiforms, right? And how they are supported. So it is a pleasure in itself. Such a beautiful mechanism, and this mechanism is related to what is called as the arches of foot, right? You know, many times people have got that flat foot, right? अब करने के लिए क्या करना है? पाँव भिगो के ब्राउन पेपर हो उसके ऊपर just put your footsteps, and then when you see कि हाँ वो जो impression पड़ी, that impression that should be like that should be like this. That should be like this. And then we have got, right? So this is how it should be. If it is flat, that leads to flat foot. Flat foot person, when he tries to run, so he'll be getting severe pain in the calf muscles because the weight transmission will be wrong. So for that understanding, we'll be learning more about the tarsals. Okay? Then it moves to metatarsals. So जो अपना पूरा पाँव का पंजा, right? That is the metatarsal. And then comes the fingers. So in fingers, once again, the same thing. We have got 14, right? All those 14, same style. So angutha is 2, and baki ka 1, 2, 3, 1, 2, 3, 1, 2, 3. In little finger, to those phalanges, they are so small.
Sir?
Huh?
The fibula is like is pencil-like and it is covered by muscles so as to protect itself like from external injuries, right?
No. Its function is to provide surface area to the muscles. Because we don't want to protect the fibula. Fibula to kya? Fibula is not taking part even in the knee joint. The entire weight bearing is from hip joint to femur to tibia. In the knee joint, when we'll study knee joint, you'll find that fibula is out of the knee joint. It is not taking part even in the knee joint, right? So its purpose is only one: give surface area so that muscles can be attached, so that we can move the muscles effectively, right? So that is the purpose of various bones. Not all the bones, they will be like weight bearing. Many of the bones, their function is to increase the surface area so that they tell the muscles, come and get attached, right? Okay. So total there are 206 bones. So we have got the upper limb and the lower limb. The most important concept which you have to understand is,
Sir, does fibula articulate with tibia? Then if it's not connected at the knee joint, then?
I told you, it is connected with muscles.
No, I meant if it is articulating with tibia, I meant fibula.
No, it is.
Is there any
Wait. See, right now, what I'm telling you is, we are deviating and there is so much of interruption coming. What I'm asking is, say, at this point of time, just understand that these are the bones. When we'll be discussing actually the knee joint, then we'll be going into so much of that all answers will be clarified. Right now, even if I'm answering, I know that I'm not telling you complete thing. Why? Because there is meniscus in between. There is medial meniscus, there is lateral meniscus. And if I say that there is a collateral ligament which will be supporting from, there will be ulnar collateral ligament, there will be radial, there will be, say, tibial collateral ligament, then there will be synovial capsule, because that will be the complete answer. So right now, when I'm trying to answer, it will be an incomplete answer, right? So
that is ACL, PCL.
Right. So right now, don't worry much about it. First, just absorb everything, whatsoever is over here, right? Then we'll come to those questions. Achha. Coming back to this is upper limb, lower limb. In upper limb, lower limb, the thing is, in forearm, there is radius ulna. Radius is lateral, right? And ulna is medial. Similarly, in leg, this is the tibia, this is fibula. We saw that fibula is lateral and tibia is medial. So big toe is connected to radius, right? And so this big toe, big bone, that is radius is a bigger bone. Similarly, over here, tibia is a bigger bone. So जो अपना अंगूठा है, that is connected to radius. Similarly, पाँव का big toe is connected to tibia. That means big bone, it gets connected to thumb, it gets connected to big toe. Right? बस इतना ध्यान रखना. So easy to figure out. You might ask, radius, ये बड़ा bone है, it is on lateral side, and in leg, tibia is the bigger bone, it is on medial side. When the baby is born, that's where the interesting part of embryology comes into picture. ये body, and these are called as the limb buds. Body में से टुक टुक वो buds निकले, buds, right? ये जो है ये upper limb बनेंगे, ये lower limb बनेंगे. So then there is rotation. So upper limb they rotate like this, and lower limbs they rotate like this. So that's why the direction changes, right? This is where the beauty of embryology comes into picture. Okay? All right. So what are the functions? All the functions, they are linked with, all are with S.
Sir, tibia is also known as the shin bone, right? That's all I wanted to ask.
So what's the question?
No, I was confused if it's called as a shin bone or not.
Okay, so coming back to this function. Function S. S is, it gives shape, it gives support, right? Because your entire body is shape and support to muscles, that is the function of bones. Then the answer of fibula, right? It gives surface to muscles, ligaments, tendons. When it comes to ligament, ligament means it is bone to bone, right? Now see, this is the knee joint, right? This is the knee joint. Yahan pe, and this is the knee joint, right? Knee joint. So this bone will be what? This would be which bone?
Femur.
And this one would be tibia. This is the knee joint, right? So there is one ligament which is connected over here. Ligament. So it is bone to bone. That means it will be connecting femur and tibia. So that's why this is supporting ligament. Ligament means it is bone to bone, and because it is just supporting, so it is called as the collateral ligament, right? Collateral ligament. But there is collateral ligament even on the opposite side also, right? So here is the fibula. So there is collateral ligament over here also. So that's why we'll be telling tibial collateral ligament, or because the tibia is on which side? Tibia is on the medial side. So we'll call it medial collateral ligament, and this will be called as the lateral collateral ligament, right? So that is how we'll be identifying all the structures. So that is an example of ligament. And then there are tendons. Tendons means bone to muscle. Say for example, biceps, right? Its name is biceps. Biceps. Ceps means head, right? It came from the word cap, head. So it has got biceps. It has got two heads. One is a long head and second is the short head, right? Long head and the short head. So that is how the biceps is connected. So this is the fleshy part, right? जो bulge होता है, right? Which we show off. So that is the biceps, bulge, right? Muscular part. But then there are two tendons. So one is the short tendon, second is the long tendon. So when we'll be learning the shoulder joint, we'll see how the biceps, that long tendon goes, it winds around the group and all the way it gets connected to the scapula. And that's why when we flex, so it is like from here, it is pulling, right? So that's the biceps. Similarly, on the back side, there is triceps. That means now you know there will be three heads. Right? So that is biceps and triceps. So that is the tendon. Then it acts as a lever. It serves as a lever, right? So mechanical advantage. Some of the muscles, right? They'll be like there will be groove. Even in biceps also, right? There will be a groove. It will be passing through that groove and then it will be connected. So it is because of this, right? The muscle, when it contracts, it acts as a pulley. So that is what gives us the mechanical advantage. मतलब कुएं में से पानी निकालना हो, so right? There is pulley. You just put the rope on pulley and then you can easily take the bucket out. Try to take it directly, right? You have to generate so much of strength. Right? So that is where it will be acting as a lever. Safety, thorax, abdomen, not much to say because entire rib cage, its main function is to protect heart and the lungs. Similarly, the abdomen. Right? Though abdomen, muscles will also come into picture. It stores calcium and phosphorus. Right? Then they form the sinuses. These are called as the sinuses. Sinuses are areas which are filled with air, right? And when someone is having common cold, right? Common cold, these sinuses, they are filled with fluid. And that's why suddenly from the sound, right? Normal sound, right? They become very heavy, right? Because there is no resonance. When you say that vibration is because of sinuses. So these sinuses are air-filled spaces inside the skull. So they make the skull light. At the same time, it gives what is called as the resonance to the voice. This resonance is lost. Person's voice entirely changes. It is because these sinuses, when they are filled with fluid, and that's why it is called as the sinusitis. Itis means inflammation. And one of the signs of inflammation is collection of fluid. Inflammation, right? Swelling, collection of fluid. So when there is collection of fluid, so these sinuses are filled. They are not big spaces, small spaces filled with fluid. So then they cannot vibrate. So this resonance is lost. Right? So such is the beauty. Then bones, they produce some special cells. They are called as the RE cells or reticuloendothelial cells, and they are vital for immunity. Right? These are the very important cells. They are very good fighters. Finally, bones, they make blood, the super blood, right? They are the places where the blood is formed. So that's why if someone is having myeloid leukemia, that is when the bone marrow is involved into that cancer, right? Blood cancer, the blood cells themselves, they are affected, or the production site itself is affected. So when the bone marrows, they are affected from where the blood is getting formed. So that is what is called as the formation of abnormal cells. That is called as the leukemia. So there are 4 types of leukemia when we'll be studying it: acute myeloid, chronic myeloid, acute lymphatic, and chronic lymphatic. Right?
So sir, this can also result in weak immunity.
Abhi ke liye don't worry much about leukemia, right? I was knowing that questions would come. Don't, right? Because we have not discussed even a bit of ek jeere jitna bhi discuss nahi kiya. The idea was just to tell that when the bone marrow is involved, right, abnormal blood can be formed because that is the formation, that is the factory from where the blood is getting formed. Right? Leukemia is a topic which will last for not less than 15 days. It is that wonderful topic. When we'll come to treatment, when we'll come to diagnosis, right? It is that topic. Okay. This word you must know, erythropoiesis, right? Long name, yaad rakhna. Erythropoiesis, formation of blood. So when they say
formation of RBC.
Correct, formation of RBC. And then there are few drugs which are called as the erythropoietic drug, right? So that means they are banned thing because they generate more RBCs for short duration. So more RBCs means more oxygen carrying capacity, so they can win the race. Those substances, they are like, when in fitness we'll talk about it, they are called as the banned substances. Similarly, there are some of the salts when you inhale, right? I'm not telling they are bad, but when you inhale, so next for 3 to 5 minutes, you'll be like Superman, right? That Popeye ne jo spinach khaya, uske jaisa ho jayega, right? You'll be able to lift very heavy, extremely heavy, but not advisable, right? एक दो बार practice के लिए करना हो, when you really want to know that how much can you really push or lift, ठीक है, एक दो बार कर लिया, that's fine, not the regularly. Because it will see, being a medico, we'll see that straight away it involves the first cranial nerve, olfactory nerve. And olfactory nerve, its length is only this much because then it is straight away connected to top, right? Via the nasal septum, straight away it is connected to the brain. So that's the reason that it gives that kick, but that kick is only for short duration. The classification. The classification is from the shape to development, regional, and the structural. We start our journey with shape, right? So shape, how the bones develop, what are the various regions in which we'll be defining, and the structural classification of the bones. Let's start with the shape. Right? So this is the shape. As you must have noticed that everything is written in the form of mind map. Right? There are no running long sentences, only the keywords they have been written. You remember these keywords, that will give you the complete picture. Right? So the bone, not much of the description. When we say long bone, obviously the bone which is long is a long bone. Right? So typical long bone. Typical long bone means no description necessary. A typical long bone, we talk about femur. Dikhta hi hai, right? There is no doubt. I mean, this is a long bone. Who can deny that, right? This is a long bone. Pakka. This is a long bone, right? Tibia, fibula, long bone. Humerus, pakka, long bone. Radius, ulna, definitely long bone, right? So they are coming into long bone and they are called as the typical. So femur, tibia, fibula, humerus, radius, and ulna, they are typical long bone. So if typical, then there must be some speciality. Yes. Some of the bones, they are of very small size. They are the miniature bones, chote chote. But which are they? Metacarpals, right? ये आपका पंजा, छोटे छोटे bones, right? They are all small bones. So that's a miniature. So metacarpals, metatarsals, phalanges, right? They all are, कहने को तो लंबे bone ना, right? They are all long bones. They are tubular bones, right? They are like cylinder. This is the question of the viva. Which long bone is lying horizontal, right? Horizontal. There is only one bone which lies horizontally, and that is none other than clavicle, right? None other than clavicle. But अगर जो आप लेट गए, सो गए, तो then humerus भी ऐसा नहीं हो गया, right? Horizontal, depending upon position. No, but this is with respect to anatomical position, right? With respect to anatomical position. Otherwise, so I make my hand, ये horizontal हो गया, right? But then I'm not into anatomical position. Right? Okay. Remember these names. The bones, they will be forming into epiphysis, and the diaphysis. Diaphysis. Epiphyseal end means it is a growing end. Growing end. Diaphysis is a shaft. So bone grows from these ends, right? Shaft to wahi ke wahi rehti hai. Gradually more and more minerals are kept and shaft becomes bigger and bigger and bigger, right? So that's why those growing ends, they are called as the epiphyseal end or the epiphysis. One email which was regarding the nutrient artery. Nutrient artery. Yes, you are very right. There is, every bone has got a nutrient artery. Because when we say that these bones, they regenerate, so that means they will be requiring nutrition. If they are requiring nutrition, there is a specific artery which will be supplying all those nutrition. That nutrition artery is called as the nutrient artery. Nutrient artery. And when during our studies, every time we'll be discussing this artery because this artery is crucial. In case if it is damaged, right, whether during surgery or accident or any way it is damaged, the part which is supplying, it will be devoid of blood. And when there is no blood, so that part will start destroying. It will get necrosed. Sar jayega. Necrosis means sar jana. It will start getting necrosed. Right? And this is one of the examples. So here is the big head of femur. Big head of femur. Right? This is head of the femur. This will be the shaft of femur, greater and lesser components. That's later. Right? But this is the head. In the head, there is one what is called as the fovea. Fovea, right? Fovea means pit, khadda, right? This is fovea. In that, the nutrient artery goes. This nutrient artery, which supplies to this portion, this marked portion, which supplies to this. If this nutrient artery is broken, then this head, right? This head will not be getting any blood supply. If head is not getting blood supply, that head would start dying, right? It will start dying. So it means it won't be having that capacity to regenerate and keep that good shape. No, it will start dying. So that tissue, as it will start dying, it will be deformed, right? And when that thing occurs, it is called as the avascular necrosis, right? It is avascular necrosis. There is a classification of it, right? But right now we'll not see that classification. That is the radiological aspect, which will be combination of X-rays and MRI or CT scan. Right? But watch for this. This is the area where I want you to focus. This area. See, this is, I can zoom it, so you should be able to see it properly. See how wonderfully, this is the X-ray of hip joint. How wonderfully you can really see this outline of head of femur. Right? Can see? This is neck of the femur. This is greater trochanter. Then there is a lesser trochanter. Then there is shaft, right? And the procedure goes. But this is head. This is head. This is normal, right? This is head. Now I'll remove whatever I written so that you can appreciate that, yes, you can see the head properly, right? And this border is of hip bone, right? Is of innominate bone. So that's how it is forming. This is the hip joint. This is the hip joint. There is one artery which is going like this and it supplies. If this artery is broken, right? So see what happens. Can you see? See the difference? One striking feature is that bone density itself has decreased. This is a case of osteopenia. And with stage 1 avascular necrosis. Avascular necrosis. Avascular necrosis. Necrosis means tissue is dying. Avascular. Vascular means when it has got blood. Avascular means no blood. So because of the lack of blood, there is, see the head of the femur. Right? Quite deformed. Just by looks, you should be able to figure out. Here, it is bit proper, but from here. So this is what is called as the avascular necrosis. Now this is the beginning, right? Still the head is intact. So how this person would feel? Person would feel pain. And that pain would be when person will try to walk, to then there will be severe pain. There will be severe pain. See the next case. See what has happened. There is massive erosion and the destruction and reabsorption of head. Means head is not only destroyed, but it is resorbed. Some of the portion of the head is taken away, as if eaten away. See, the whole curvature itself is lost. This is stage 3 of avascular necrosis. Right? In stage 1, when it is completely eaten, so then there is no other option but to go for THR. THR stands for total hip replacement. Replacement. So that is when the bone is completely eaten. So when it is stage 3 or stage 4, the person needs to go for THR. Till stage 1 and 2, there is conservative therapy. Don't put more weight and get the serum calcium, D3 assessed. And if it is into that stage, person can revive.
Sir, the femur bone is also replaced. The femur bone is also replaced.
Femur bone?
Yes, sir.
It is the head. This is the head of the femur which is affected, right? Because for rest of the areas there are other nutritional arteries, but for head there is only one artery which is going via fovea. And this fovea, when sometimes the leg is outstretched, right? Yeah, zyada khich jaye. So here you can see the fovea, right? This is the shadow of the fovea. Fovea you can see very clearly. So if that part is damaged, so then head is affected. Rest of the bone is not affected. So in total hip replacement, they just put this artificial head and then there is a nail which goes into that normal bone. This is the metallic part and this is there the nail goes. Right? Itna karke, and then the nail goes. So that's this total hip replacement. And then person is finding much better. Right? Pain vagara, it will go.
So,
Sir, this X-ray is
what
of
is the
female body.
Sir, the nutrient artery cannot be repaired surgically.
If it is, say, to reach to that area itself is very tricky because when you try to reach to that area, right, it is not so the bones are there. It is a complete synovial membrane, right, complete tissue. So you open it, you reach to those, chances of repairing, they are minimal. Because when it is damaged, तो पहली बात तो patient को पता ही नहीं चलेगा. When the patient really comes to you, patient rarely comes to you at stage 1 because in stage 1 he'll be having some hip discomfort. जरा सा discomfort हुआ तो why people would say करे ये CT MRI कराने की बात कर रहे हैं, डॉक्टर के पास क्यों जाना? No one goes, right? They start taking some pills, painkiller ले ली तो ठीक हो गया. When it goes to stage 2, when it goes to stage 3, जब लगा कि अब तो चला भी नहीं जा रहा और then someone tells कि यार आपका पाँव एक छोटा एक बड़ा है, then they say आप चलो डॉक्टर के पास. So it happens.
Sir, head is the growing end.
Head is growing end.
So in the hip replacement surgery.
No, it is metal. It is metal. All metal. Titanium heads.
Using biotechnology tools.
Yeah.
Sir, then the regenerative property of the bone will be lost now.
That area would obviously be lost. Avascular necrosis means what? Regeneration has been lost. Because for regeneration, you require blood. You require nutrition. When that is cut, when the supply line is cut, entire troop is going to go down.
So it is not for the entire leg, entire bone?
No.
Only for the head part?
Head part. Avascular
Sir,
necrosis.
Is there any specific reason for that, for low blood supply in that region?
No. We will not discuss right now because we'll not be able to complete the topic. Knee replacement, total knee replacements, why they occur, that is totally different reason. Totally and completely different reason because knee joint is far more complex. And it is one of the most important weight-bearing joint where there is direct weight. Right? In the hip, it is indirect. The angle is different. We'll see that.
So, sir, all X-rays you showed were of female body, na?
No, they were from different patient. Okay, so coming back to this shape, long bones, right? We talked about it, long bones. Then there are short bones, right? Short bones, carpal, tarsal, they are all short bones. Then there are flat bones. These bones, they are not rounded. Right? Humerus, femur, they are round bones, right? They are like pipe. These are flat bones. Skull bones, they are flat bones. So their formation is different. Skull. Ribs, right? Ribs are like patti. From backside, they come, right? They are literally, when you'll see that they are absolutely flat. Sternum, right? It is a flat bone. Scapula, it is a flat bone, right? They are not rounded bones. They are like layers. So these are all flat bones. Then comes the irregular bones. They don't have any specific shape. The first candidate, hip joint, hip bone, innominate bone, he is irregular. All these vertebral body, transverse process, right, and the spine. So these are the vertebrae, but they are not defining any specific shape. So that's why it is called as the irregular bone. So vertebrae. Then sphenoid bone. right? Inside, that sphenoid bone is like a big bird, but then there are two extra wings, but it is pretty irregular. So sphenoid bone, ethmoid bone, when you'll see ethmoid bone, then temporal bone, right? Occipital bone, right? These are the bones, right? The temporal bone, which is here, right? Occipital bone, which is on the back. So all those are irregular bones. They don't have any specific shape. Then comes the pneumatic bone. Pneumatic bone. That means there is air inside. When it is air inside, so they are sphenoid, ethmoid, maxilla, and frontal. These are called as the PNS. PNS means para nasal sinuses. Sinus means it's a space, right? This is nose, near to the nose, because all these spaces, they are here, right? So that's why it is called as the paranasal sinuses. Paranasal sinuses. So ethmoid is sphenoid, maxilla, and frontal. Then we'll be having some of the bones which are developing. They are called as the sesamoid bones because these bones, they are developing into other muscles. Say, for example, this is the patella, the knee joint. Right? But if you see patella, so it is into this quadriceps. Quadri means it is your thigh muscle, right? Quadri means it has got 4 heads: lateral, medial, intermediate, and the rectus, right? So it has got 4 heads. So it is called as, it is the muscle of thigh. So it is called as quadriceps femoris, the muscle which has got 4 heads. So that is the muscle of the thigh. The entire shape and the bulge of the thigh is because of this muscle, right? Quadriceps.
And then, sir, what about hyoid bone?
What about?
Hyoid bone.
Those hyoid bone will come. It will come. Just hang on. Right? It is the bone which is developing. I'll show you the development. Right? Let it come. It is again, it's an irregular bone, right? It is like this, and it is like a shield. It is like a shield. It's like this. This is the shape of the bone. So you have to put it into the form of irregular. Again, it is a flat bone also, right? It is a flat bone also. So long bones. Then we have got the sesamoid bones. This is fibula. So this fibula bone, it is into the gastrocnemius. Gastrocnemius is the muscle of calf. The entire shape of the leg, right? This is gastrocnemius, right? Gastrocnemius, right? Not gastrocnemius. So it is gastrocnemius. Then in flexor carpi ulnaris, the pisiform, the bone which I was talking about, a small pea-like bone, right? Very small, matrakadana. It is flexor carpi ulnaris. So it is into that muscle. So this muscle, it is on the radial side. These are the carpals. So it is leading to flexion of the carpals. The muscle which is leading to flexion of carpal on the ulnar side, it is flexor carpi ulnaris. Similarly, there will be one muscle which will be on radial side, so it will be called as flexor carpi radialis. So this means these two muscles, they are connected. When they contract, wrist drop. Wrist is like this, these muscles contract, and the wrist is taken down. So quadriceps femoris, it has got 4 heads. It is a muscle of thigh. So their names: vastus, vastus lateralis, vastus medialis, vastus intermedius. Vastus means big. So there will be big muscle from the root top. One muscle goes on medial side, one on lateral side, one is in between, and then there is one straight muscle. It is called as rectus femoris. It's a straight muscle. So that muscle, it lands on top of it. Right? So these are but collectively, all the fibers, they are merged with each other. So that's why we collectively call the whole muscle as quadriceps femoris. The muscle which has got 4 heads, and it is for thigh. Because femoris word, femoris is for thigh. Then they will be connected to patella. So this is the reason that patella, because when we sit and when we stand, the shape of the patella, it keeps on changing. Then there are some accessory bone. bone फालतू में पड़े हुए हैं. They are called as the supernumerary bone. Supernumerary bone means that small piece of bone is lying somewhere. Say for example, sutural bone. These are the fontanelles, right? The final effect should be absolutely straight, and that's the area where those fontanelles, they were present, now they are diffused, right? So these are what is the suture. Sometimes you'll find some small bone over there, and rest of the thing is packed. This bone will not cause any harm, but it is present. So being a radiologist, right, you should be able to see all these structures. So this is why you say that, okay, presence of supernumerary bones, sutural bones, right? Then rider's bone. So when the person is riding, so that area where that ischial tuberosity, right? So there is normal ossification of soft tissue. Normally only bones to bones ossification. Ossification is formation of bone. So that soft tissue becomes hard, right? So this is normal ossification of soft tissues. The development part, how it develops. Oh, the number has reduced to 246. Ah, yes. Fast question. Want to ask?
Sir, I had a doubt that is hyoid bone a part of facial bone? Because many books says they are and some says it's not.
No. It is considered as an extra bone. It is okay. You want to take. See, it really doesn't matter in which group you include. Right? So from books to books, it might differ. But the importance of hyoid bone is what? That is very crucial, because when someone is strangulated, gala daba ke mara, that bone gets fractured because its lateral horn is very weak. It gets fractured. Right? Similarly, when we'll be learning in more detail, atlas and axis, the cervical vertebra.
First and second cervical.
First and second, right? First and second. So this cervical vertebra, this first is like a ring. C1 is like a ring, and C2 is big with the dents. जब किसी को फांसी लगाते हैं, right? So then there is a note. So as the person hangs, this gets broken. As it gets broken, just immediately over there is medulla oblongata. So that medulla oblongata is crushed. Medulla oblongata is that area which is for our respiration. So that respiration is arrested and person dies. Gardan tod dena is what? It is this. In many of the Bruce Lee movies, right? They say they just hold the head and they tap, right? So what is that? When the head is abnormally rotated, so this C1, it vigorously moves over C2 and then the dent is broken. And the moment it is broken, because this is the area where the brain is, that cone is there, right? So in that cone, above there is pons, then the medulla oblongata. In medulla oblongata, there is respiratory center. Respiratory center is gone, game over. In developmental, this is some of the bones, they will be developing into the form of membranes, right? Membranes. Some of the bone, they will be into the form of cartilage, and then that cartilage, it gets strength, banti hai, right? And some of them, they are membranocartilaginous, that means it is mixed. Some of the good example, membranous bones, skull and face. Skull and face, they are the membranous bones. So as they develop, they'll become stronger and stronger and stronger. Right? So that is membranous. Cartilaginous, it is like first pre-formed structure. Chote bachche ka, if you take the X-ray, so you'll find that isko itne sare fracture. No, there are no fractures. There would be, upper limb would be like a very thin, then head is separate, the lower region is separate, then just like this, then the bones are like this. All are cartilage. Then later on, those cartilage fuse and then they become ossify and they form the bones. Importance from this ossification, you can predict the age, right? You can predict the age. So for the upper limb, lower limb, vertebra, and the ribs, these four things, and you can diagnose what is the age of the patient. Right? So in forensic medicine, there is a complete method about X-ray comes to you. You say, okay, give me the X-ray chest, give me the X-ray of hand, and give me the X-ray of skull. And then you say, okay, his age is 21. Right? So you can diagnose it with very much precision. Membranocartilaginous, say for example, there is membrane, but the cartilage is also laid down. So clavicle, mandible, right, jaw, occipital, that is back, temporal, this side, sphenoid, it is inside the skull, right? So these are the bones which are membranocartilaginous. Here comes the visceral bone. These are called as the visceral bone. These visceral bones are like hyoid and the ossicles, right? Ossicles, we talked about auditory ossicles, malleus incuscatus, middle ear, right? So they are called as the ossicles. And the hyoid bone. In embryology, the big topic is pharyngeal arch. One of the most complex topic. Pharyngeal arch, how it really forms, and it leads to the formation of face, the structures which are present over here, how it really forms. So that is the pharyngeal arch. Before head and neck, we'll be discussing embryology so that the concept becomes very easy for you to understand head and neck. Otherwise, you keep on confusing why it happened. Sometimes it is left, sometimes it is medial, and then it becomes lateral. Kya jarurat hai? But there is a reason behind it. That is what we'll be discussing. Hyoid is part of that. When it develops from the pharyngeal arch. Finally, easiest part, regional, one what is called as the axial, and second is called as the appendicular. Axial means midline. So skull, vertebral column, thoracic cage, the body part. And the appendicular part is extra, right? Extra. So we have got the upper limb and the lower limb. So they are the appendicular part. Finally, for the structural, in the structural, macroscopic, bone cut kiya सीधा nazar se directly dekha, right? That is called as the macroscopic. When you are watching it under the microscope, it is called as microscopic. This is macroscopic. Macroscopic means with your eyes you see directly, right? Directly. So you'll find that in some areas it will be compact, and in some it is spongy. देखने में पता चल जाए, right? Spongy is like sponge. There'll be big spaces. So that is spongy bone. In compact, you won't find it. So, कहाँ पे? See the logic. Shaft. Shaft is diaphysis. Yes, shaft is मजबूत. उसको develop होना तो हो लिया. So now it is compact bone. But those which are just developing, they are soft. They are just developing. They are becoming bigger and bigger. So they are epiphysis. Growing ends are spongy. Right? So the growing ends are spongy. When it will come to bone marrow, there are of two types, red bone marrow and the yellow bone marrow. Red bone marrow is still puberty. And then it becomes yellow. Yellow is like fat. Because of the presence of fat, it will look yellow. So hard ivory, right? Bone. So bone formation is directly supported to strain power and stretch. So this is the structure which look like hard ivory look. That is in case of these compact bone. And spongy bones, they itself would look spongy. Bone formation is directly proportional to strain power and stretch. So that's why when you go for the exercise, if you do the exercise randomly, right? No, not effective. But when you are holding it, that means there is a sustained stretch. That is what is needed. How much weight are you lifting? That is what is called as the power.
Sir,
Huh?
sir, what is the meaning of ivory?
What is the meaning of ivory? Ivory means hathi daat. Hathi daat. The color of hathi daat. White. Pink, that creamish color.
Okay.
Because they are bones for the elephant. They are the teeth. They are the bones. So this is the tensile strength, and this is what is called as the compressive strength. So tensile is when this is the bone, and when the bone is getting pulled, right? When the tension is created. So that is called as the tensile strength. So here there are type of fibers, trabecular fibers, they are involved. And compression strength is when the pressure lamina, which is parallel. So the bone is like this, and the pressure is also getting like this. Right? So for example, this is the bone. So when the bone, these are the fibers. Right? These are the fibers which are called as compression lamina, and the fibers which are horizontal. Horizontal, they are called as the tension lamina. So even when you will see that bone formation, it is layer by layer. So whether it is horizontal or it is vertical. So when this is a bone, when the pressure which is generated on the bone is like this, so it is what is called as the tension lamina. When the bone pressure is like this, so it is called as the compression lamina, 90 degree. When it comes to microscopic, so in microscopic, lamellar bones, which are developed layer by layer by layer, right? Like skull bones. So that is the layered or the lamellar bones. Then some bones, they are woven bones. Woven bones. Right? So for example, fracture repair. So that fracture is there. So then layer by layer by layer, then layer will start mixing, then finally the bone will be formed. Right? Carcinoma of bones. This we'll learn more about it in pathology. Carcinoma of bones. So then the bone, and as if something is getting produced extra from the bone. So that extra formation, and then it becomes so big. Right? And in case of fetal bones, in fetal bones, so there was no bone. So it is that formation that it gets moving. So that is what is called as the woven bones. Fibrous bones, they are in case of that young fetus or reptiles, right? Saap vagera. Then we have got the dental and the cement, that is for the tooth. So that's it for today. Now today's session is such that revise it bit properly. Dekh lena, aaj hi, right? Today only, just go through it and you will like it.
Sir, I had one doubt regarding the ossifications of bone. So during some people have microfractures during skipping or any other exercises, then is there any particular age that the repairing speed or the repairing frequency fluctuates or decreases?
You have answered your question, because whenever there is fracture, then can be multiple reasons right from the beginning to end. Right from the formation of bone to blood supply to abnormal muscle pull, right? Or the abnormal pressure, all those things. But it will come in ortho, come in more detail, because we'll be able to identify all the axes.
Okay.
Okay. Thank you so much.
We have to write all this in our notes.
No, this PDF in as such I am giving to you, right? So it has got everything, but yes, you have to write these things in your mind. So next time when we'll be talking about that, okay, let's discuss the clavicle, and straight away I'll say the clavicle is a horizontal bone, which is a membranous bone, right? And that's the S-shaped bone, and it is this junction, which is the weakest area, and which is attached with these muscles. So whenever there is fracture, so this area will be pulled like this, and this will be pulled like this. And this is the fracture which we have to repair, right? So at that point, we won't be going into all these terms again. So idea is only this much.
Okay, sir.
So you can make your own notes, but do get it registered into your brain. And one more thing, as we proceed, do revise first file, second file, third file, right, as we proceed, so that you are not forgetting anything. Because the moment next week when we'll start, right, all these terms will come suddenly together, start coming up together. Right? I'll give you enough practice for that also, but this is what I'm telling.
Okay, sir. Thank you.
All right. Thanks
Sir,
a
and
lot.
one more question.
Last.
So can I?
Bolo.
So I had regarding tibia, like you said, if someone hits there, it pains. So is it the bone that pains or a particular artery or vessel passing upon it?
My dear, artery, they never carry the pain sensation. Arteries, they carry the blood. It is the nerves. Nerves, they carry the pain sensation. Now, because the bones are rich in nerve supply, right? So if that nerve is disturbed, nerve is hit, so that will carry the pain sensation. Otherwise, अच्छा, have you experienced कि कई बार वो हाथ ऐसे लग जाए पूरे हाथ में जैसे करंट लगा?
Yeah, there's some nerve is there near the
Ulnar
elbow.
nerve. There is ulnar nerve, right? There is ulnar nerve which is just over here, right? And that nerve is quite superficial. So that's why if that nerve is even touched and pressed, so you will feel the sensation in the hand, right?
Yes, I was asking same, like, is it the same case with
It is the
tibia also?
nerve. Same thing. It is the nerve. In tibia, तो क्या कि nerve is not, मतलब the entire bone which is so rich and it is superficial. You hit on the bone, so there will be strong generation. Waves of pain sensation will be carried. Right?
Okay.
So see you next time. Take care.
Bye, sir.
Thank you, sir.
Bye-bye.
Bye, sir. Thank
Thank
you.
you, sir.
Bye, sir. Thank you, sir.
Thank you, sir. Bye.
Bye-bye.
Bye.
Thank you, sir. Thank you, sir.